Today we have Omada Health Strategic Alliance Manager, Jenna Ackley here to present this month's webinar, How to Use Technology to Manage Chronic Conditions. Jenna will provide an overview of Omada's chronic care or chronic condition management programs. Omada Health is a digital care company dedicated to inspiring and empowering people to live free of chronic illness. Jenna has over 14 years of experience in the healthcare industry and has been with Omada for over 4 years. She is passionate about improving the lives of those living with chronic conditions. Based out of Boston, Massachusetts, Jenna and her husband and 2 children are Green Bay Packers fans, thanks to her husband's lifelong allegiance to the team. That's a fun little nugget for everybody here to know. Thank you so much for being here with us, Jenna. And with that, I will turn it over to you.
Excellent. Thank you so much for that introduction. And yes, even though I'm based on the East Coast, we do have Wisconsin ties. So excited to be here. As mentioned, really for today's presentation, we're going to have a chance to go through the Omada program and how it is that we can potentially support you or a loved one through our partnership with Security Health Plan. So excited to be here. So let's dive right in. So really first, to ground ourselves, we wanted to give you a sense of who Omada is as an organization and how it is that we describe ourselves. So Omada is the virtual first provider that improves health through lasting behavior change. The key thing here to really think about is that Omada is a digital program. So you're going to be hearing a lot of digital support, virtual support throughout this presentation. But at the end of the day, our overall goal is to really help meet members where they're at to achieve their overall health goals. So what exactly does that mean? So from an actual program perspective, so there are 2 paths that we can do to support our members. So we have an Omada for Prevention program, as well as an Omada for Diabetes program. So our prevention program is really designed for individuals who are not yet diagnosed with diabetes or hypertension, but may be at risk. They may be struggling with weight challenges or other health issues, and that they really want to focus on making that lifestyle change. So that's really how our Omada for Prevention program is set up. And then our Omada for Diabetes program is, of course, designed for individuals who are currently diagnosed with diabetes and can leverage Omada to support them through that journey. So in summary, you can think about the Omada program being available for adult family members or yourself who are potentially at risk for type 2 diabetes or heart disease, or are already currently living with diabetes. And you may be eligible for the Omada program through your partnership with Security Health Plan. So before I dive into these statistics, I want to take a moment and make this a little less formal, right? Let's imagine that we were having coffee together. I wouldn't sit here and start to throw out stats and tell you, 1 out of 3 Americans has prediabetes. No, we would likely sit back, have a conversation. I would want to ask you questions and understand, why are you here today to learn about Omada? Why did you decide to listen in on this webinar? Did you perhaps recently go to the doctors and learn something about your health? Or did you perhaps have a conversation with a family member that really, sparked something in you that makes you want to focus in on your health? Then we'd probably talk about, let's think about what are our goals for the next 5, 10, 15 years? What are you really hoping to achieve, in this life that we're living? And how can Omada support you? So that's really, where we come in from a support perspective, right? Omada is here because of this, stat that we're looking at on the screen. The reality is 1 out of 3 Americans has prediabetes. And in fact, 4 in 5 don't even know that they have it. From a diabetes perspective, we have 1 out of 10 Americans living with diabetes, and 1 in 5 don't know that they have it. So really, we recognize that navigating a chronic condition is tough, but having the support along the way can make all the difference. And that's really where Omada comes in. So Omada surrounds members with tools as well as personal support to help them make lasting, meaningful changes, one small step at a time. In fact, Omada is currently already supporting over 700,000 members on their path to better health. So now I'm going to dive in and talk a little bit about what each of the components of the program entail. But before we go into that, I want to just highlight a few administrative items when you think about the Omada program. So the first one being that from a qualification perspective, this is designed for adults, so you must be aged 18 or older. And for our diabetes program, it's quite simple. You simply just have to have a diagnosis of either type 1 or type 2 diabetes. And for our prevention program, as I mentioned, this is the program that's really focused on individuals who are looking to get healthy. There will be a clinical requirement in the sense that you'll have to have a high BMI as well as potentially one additional risk factor, whether it is you're a smoker, you have hypertension, prediabetes, or if you do have a high BMI of 27 or above, you can get accepted into the program. There's a lot on the screen right here. We don't expect you to memorize this, and we'll talk a little bit later about how easy it is to get into the Omada program by answering basic, simple questions by going to our landing page that we have set up for you to help identify which program is right for you. So we'll make sure that we highlight that throughout the presentation as well. So now let's dive in and actually look at each component of the Omada program. So the first one I'm going to talk through is our Omada for Prevention program. So really, again, going back to the reminder that Omada is a digital program, so you can take advantage of the program the comfort of your own home. You can download the Omada program by leveraging your smartphone, or you can also access us through your desktop computer. The beauty of this is that Omada is designed in a way to really meet members where they're at. So you don't have to engage with Omada at a certain time of day. It really is designed to meet you where you're at. So if you want to engage with Omada at 9 o'clock at night, you're able to do so. So that's really the beauty of the program. Now we'll talk about what actually is included within the Omada for Prevention program. So the first thing I'll highlight, you'll see on the screen, is a picture of a scale. So every member will get a connected scale. This is one of our members' favorite features of the Omada program. This is sent to your home when you kick off the program, and we automatically know that the scale is designed or designated for you. You simply pop in batteries and it's linked to your profile. The reason that we provide the scale, it's really as an opportunity for you to track your progress over time. So once you start engaging in the Omada program, we'll encourage you to weigh yourself, and then you can track your weight over time within the platform. Not only will you be able to have access to that data, but you're also going to get the support of a real-life human health coach. So the human health coach that will be working with you will be able to track your weight progress over time as well. We'll be able to sort of work with you to understand, what is your starting weight and what is your goal weight and how is that progressing week over week. The reason I say human health coach is the fact that I want to stress that even though it is a digital program, you really are engaging with a real life human behind the screen. So you're not going to be getting automatic messages from a bot. You'll have a health coach that's really going to work with you, that's going to understand, who are you as a person and what are your overall health goals, right? We talked about at the beginning of this presentation. What are you thinking about in 5, 10, 15 years? Share that with your health coach, and that can really help them design the program that makes sense for you. In addition to the health coach, you'll also kick off the Omada program with a peer network group. You can sort of think of this as an online community of other members who are starting the program the same time as you and are working on similar health goals, right? They'll be wanting to lose weight and get healthy for their family or themselves. The beauty of the peer network is that you can engage with one another, you can share tips and tricks, recipes, you can support, you can ask questions. Also, though, I do want to share that this is a personal journey. So if you're the type of person that isn't interested in engaging in this online network, you don't need to do so. You can simply just ignore the messages that are happening with the group, and you can simply work privately with the coach. There's another area within the application that you can private with your coach. You can message with your coach privately. Another thing I will share about the peer network program is that even if you choose not to engage, we often hear from members that are a little bit more shy or it's just not their preference. They still love reading the conversations that go on with members because they find that they do get helpful information just reading what other people are recommending or sharing. So again, this program has a number of different tools and actions that you can take, but at the end of the day, it really is designed to kind of meet the member where they're at and pick and choose what makes sense for them. And then last, but certainly not least, we'll also have interactive lessons that are published one lesson per week, and they're focused on areas such as nutrition, exercise, stress management, etc. And then overall, on average, Omada sees that our members lose 5.5% of their body weight after 12 months. That is clinically significant because we know that losing even just a small percent of your body weight can help reduce your risk of developing diabetes or hypertension. So let's transition and now talk a little bit about our Omada for Diabetes program. So very similar in what we just talked about with prevention, you will still access the program in the same way. You can have us on your smartphone, or you can engage on your desktop computer. And the Omada for Diabetes program is tweaked in a way that is very much specific and tailored to support a member living with diabetes. So first we'll talk about the connected devices, right? So we spoke about the connected scale that you get in our prevention program. In addition, if you are living with diabetes, you will also get a blood glucose meter as well as a continuous glucose meter. And these are also connected to the Omada program, and it's synced to our application so we can track your readings over time. And also for you personally to be able to keep track of what are your blood glucose readings. So similar to the scale, this gets sent to your house at the start of the program, and it's very simple to set up. This is cellular enabled, so you don't have to worry about connecting your devices to the Wi-Fi or anything like that. We want to make it as easy as possible for you to sort of hit the ground running. So you'll have these connected devices, and again, it's more for you to help sort of track your journey, but it also is very impactful for the health coach and the care team that you'll be working with through the Omada program. So in addition to a health coach, you'll also have a certified diabetes care and education specialist who will work with you to monitor your blood glucose readings over time and make recommendations, sort of talk through any challenges or questions you might be having, and can really help guide any preparation. Let's say you're going to your doctor soon and you want to talk about some of these readings. Our care team can help you sort of formulate what those questions you might want to bring to your doctor based on the data that we're seeing within your profile. So again, you have that human support, you have that human approach for the diabetes program as well. And then last but certainly not least, you will also have a peer group similar to what we talked about on the previous slide. And these will be individuals who are also living with diabetes. So we'll make sure that you're grouped with individuals who are starting the program at the same time, but also are living with diabetes. So you, again, can help sort of share learnings and support one another if you so choose. So let's move on to the next slide. Really to sort of summarize the devices, I do want to double click into this a little bit further just to make sure you have a good understanding of what are the devices that you get as part of the Omada program. So we have this broken out on the screen. So for the prevention program, you'll see that, again, as a reminder, everyone will automatically get that connected cellular scale. And then for those living with diabetes, if you have an elevated BMI, you will get a connected scale, you will get a continuous glucose monitor, as well as a blood glucose meter. So let's spend a little time talking about this continuous glucose monitor. So for those of you that aren't familiar, a CGM, as we like to refer to it as, is a sensor that is provided to members living with diabetes that they can insert in their arm, and it helps track their blood glucose readings throughout the day and the evening over a continuous period of time. So you don't have to prick your finger and sort of check your reading at that moment in time. We send this at the start of the program, so you'll get a free CGM for the first 2 weeks. And there's 2 reasons for this. One, this is really helpful for the member to see what are they coming in, what are their readings, what are some different spikes that you're seeing throughout, the first 2 weeks of the Omada program. And then the second reason is we talked about our health coach, right? Our health coach is going to be monitoring and understanding, where it is can they potentially help work with the member. So if we're seeing, a trend where there's a spike at dinner time, the coach might engage with you and start to ask questions and understand what might be causing that spike. So really the CGM for the first 2 weeks is to help sort of level set where are you coming in at the program. And then at 6 months, you'll be receiving a second free CGM. Again, it will last for 2 weeks. And this is similar goals, but an opportunity to check in, see how has Omada supported you over these past 6 months? Where can we continue to make tweaks to help you along your health journey? And then outside of that, you'll get a blood glucose meter, as well as unlimited test strips. And very similar, if you choose to use the blood glucose meter, whenever you do check your reading, it'll automatically be synced to your profile. So that's really in summary of the member devices, but this is a feature that our members absolutely love. And again, it is very seamless and easy to use. We make it very easy for the member, once they start the program, to make sure that it's synced to their account so there's no issues. So now that we talked very high level about, what goes into the Omada program, what are some of the key components, how is it that you actually are able to join? So the first place that I will recommend that you go to is we have a custom website set up for Security Health Plan members, and that is Omada for FORSHP.com/go. If you simply go here, you will have 2 tracks that you can go down. So we talked about the prevention program. This is folks that are looking to lose weight and get healthy. We would recommend that you would select this path. And then if you already are living with diabetes, you would select the diabetes path. From here, we make it very simple and easy. You'll answer very basic questions about your health. It's okay if you haven't been to the doctor recently. Some of the questions you'll be receiving is, what's your age, what's your weight, some family history about your health. And then from there, we do all the work and we understand which program is the best fit for you. And are you clinically, eligible as well? At the very end of the application only takes about 5 minutes. You'll just simply pop in your name, and then we have you put in your subscriber ID to make sure that you are covered under Security Health Plan. So that's really how you get started. So I always sort of recommend, if there's anything interesting about today's presentation or you're not sure that Omada is a good fit for you, I still encourage you to come to this landing page and just fill out that questionnaire and see what happens, right? There's no harm there. So now really to summarize the entire journey, right? We talked a lot about what the different program components are. So let's just sort of summarize it here now. Once you do get accepted into the program, we talked about how everyone will get a welcome kit sent to their home. So that's really step number 1. You get your kit, you get set up, you meet your coach, you meet your group. Your health coach, again, we talked about how you can have private messages with this health coach. You will start to share with them who you are as a person, what are your health goals, and they'll start to design a plan that makes sense for you. So again, this is a very personalized journey, and each person will have different goals and different things that they want to share and work on with their health coach. Another area that we want to highlight that is really great for members who are interested to connect further than their peer group that they're assigned to. Let's say you are planning to run a 5K in the near future, or you're very interested in learning more about healthy cooking. There's different topic-based communities that you're also able to join. So again, building on that human connection. And then last but certainly not least, here's a screenshot, as we mentioned, of the different lessons that are published within the program. So for our prevention program, we'll have lessons that are very much designed for folks that are looking to lose weight and get healthy. And our diabetes lessons will also be very much focused on someone living with diabetes. So the lessons will be slightly tweaked depending on which program you're in, but all of them are very interactive and simple to go through. And you can read them when it makes sense for you. And then really at the end of the day, once this is all put together, the goal is that we'll work with you very closely at the beginning of the program, and then we're here to support you. This is a lifelong journey, so we'll continue to be there to leverage any sort of questions you have with your coach and ongoing resources and support throughout your health journey. Some visuals here. Want to highlight the fact that our health coaches will also very much partner with you on your overall food and nutrition habits. But I do want to highlight the fact that Omada is not a diet program. Our coaches are never going to tell you what to eat, how many calories. This is really a simple way to just engage with you and understand what is your eating style and where can we potentially make some recommendations. But do want to make it clear that we're not going to come in and tell you, you're on a restrictive calorie diet or anything of that nature. And then same from a tracking perspective, very simple to either sync, if you have a Fitbit or other devices, you can sync it to the Omada app, or you can manually enter in your information. But again, it's really up to the member to engage and share what data they feel is appropriate. Now I'm going to take a quick moment and just share why we're here, right? We talked about the nitty-gritty of what the program is, how you can sign up, but now I just want to take a quick moment and actually show you an example of a real-life Omada member and what happened when they met their health coach in person.
A personalized approach for each person.
Having an issue with my blood sugars. I posed to her, having an issue with my blood sugars and try to get them in control. And she immediately said, if you were on insulin, I would maybe recommend that you get the monitor to look at and track your numbers. And I was like, okay, this could work. And so I tried it and it did work. The coaches are as much invested in me being better as I am. Anything that they're telling me is for my own good. It's not like they're going to try to dictate to me. They want to work with me. At first, I was kind of skeptical, and now it's like, yeah, this is pretty cool.
Steve and I have been working together for a little over a year, and we've never gotten the chance to meet in person. So, you know, it's digital and you're talking through text, but you really do get a sense of who each member is that you're working with. The relationship that you build is very real.
Yeah. Oh, so nice to meet you. Oh, cool.
Thank you so much.
This is really cool.
Kristen has been probably my biggest supporter, the person who has encouraged me the most in the program. We've been through a lot of difficult times together. I feel like there's no way that I could have continued on the journey with Omada without Kristen's help, encouragement, somebody to bounce things off of. Anytime I have had ideas about some things that I wanted to try or recipes, Kristen has been very instrumental in any success that I've had in the program.
So hopefully that gives you a sense of, you know, how Omada really impacted an actual member, right? Hearing directly from Stephen versus, you know, from the personal testimonials that I can share just from working at Omada. But yeah, I thought that that video would kind of tie it all together to actually hear from a real Omada member and sort of what he went through of, you know, being skeptical at first, but then just how it's really impacted his life and how much he's connected with the health coach. And then really from a security health plan perspective, we also wanted to share another member testimonial from someone who recently went through the Omada program. So this person is named Jim, and he shared his feedback on Omada is, I like what I see in the mirror these days. I still have a few pounds to go to reach my goal, but I'm confident of achieving that. Physically and mentally, I feel healthy, happy, energetic, and proud of myself. So that's another just great example of the impact that Omada had on an actual member. So really to summarize here, at the end of the day, you know, we recommend you go to that website, but if you have any questions about filling out your application or any technical questions, we have a support team that is here to support you. You can either email them or we have this 1-800 number. We also have online articles that you can reference as well if you have any, you know, basic questions that you think might be simply answered by reading some of our articles. But long and short of it is we are here to support you, and this is the correct path that you can go to depending on what your comfort level is. And then really just to summarize, as a reminder, go visit omada4shp.com/go to learn more about the program and more about how you can sign up. So with that, I know we have time for a few questions, if there are any.
Yes, thank you so much, Jenna. That was, I really liked that video. It really drives the point home. I do have a couple questions for you. The first one I have is, how do I know if I am at risk for type 2 diabetes? I know my doctor mentioned something about my labs being off a bit.
Yes, great question. So I would say whenever you have questions like that, always, you know, Omada is really here to support you in between those doctor visits. So we'll always say, you know, feel free to follow up with your doctor. But what's great about the Omada program is if you want to come to this landing page that I mentioned and that you see on the screen, you can simply go through and answer the application process, which is a risk screener that Omada built based off the CDC. And again, it's self-reported information that you can answer, and it can help determine if you are, you know, clinically at risk for diabetes and appropriate for the Omada program. So really to summarize, I think always check with your doctor too, but feel free 100% to come to this website and take that risk screener to see if you're a fit for Omada.
Another question that we received is, how often will I be able to connect with my health coach once I sign up? Will I
Yeah.
have one-on-one time, or is it only group time with a health coach?
Yes, great question. So you will absolutely have one-on-one time with your coach. The beauty of the program, because we are digital, you can message your coach 24 hours a day, and they will respond within a reasonable time frame, but you are able to message them whenever it works for you. So, maybe you're going to bed and you have a quick question, pop it over to the coach. That's perfect. On average, we see that folks really engage with the coach about 3 to 5 times per week at the beginning of the program. And then again, life is a journey, so you can message them whenever you need them, which is a great thing about Omada. So you will have the private messages with your coach. And then of course, you can also engage with them in the group setting. It's really up to the member on, what the situation is. Great question.
Makes sense. Another question that we got, I went on the website, but I still need some help filling out an application. Is there help available?
Yes, excellent question. And absolutely feel free to call our 1-800 number Monday through Friday. And then you could also email our support team. And there are agents that are trained to really help members kind of work through the application and answer any questions they might have. And you can
Perfect.
find all this on our website as well, so you don't have to memorize this.
Great. Well, I'm going to check the chat feature really quick. And if no other questions have come through, I think we can go ahead and close today's webinar.
Excellent. Well, I just want to thank you for having us. And if there are any follow-up questions, certainly reach out to the team. And we were excited to be here today. So thank you for the opportunity.
All right. Thank you so much, Jenna. Be well, everyone.